Assalamu alaikum. Ultrascan Diagnostics. This is the CBCT of the patient that you had requested. The area of interest is the lower left second molar. This is the 3D rendering. This has a distal cavity and a restoration on the mesial side. Now, if we look at the tooth from a axial view, on the axial view, we can see this is the tooth. As we are moving down, this is the pulp chamber. This tooth has a cavity underneath the restoration, which is in close proximity and touching the pulpal horn, which can also indicate all the um, sensitivity or any pain or any symptoms that this tooth might have. On the axial view, we see that the tooth starts with one canal in the distance, one big canal in the mesials, then that goes in and separates into two canals. And as we move towards the apex, the two canals join to form one at the apex. We don't see any major periapical radiolucency, it's just a radiolucency or a hypodense area at the apex, nothing major. As we move upward, the only thing noteworthy on the axial view is that there is a slight appearance of a crack on the mesiobuccal region. We cannot verify the crack on any of the other planes, just the axial plane. So we will ask the kind doctor to please evaluate this area clinically as well. The crack goes at the mid root level. If I can show you, this is the sagittal view. We can see the restoration here. We can see secondary caries, which is just in contact with the pulpal horn. If I can highlight with the yellow line, this is where we can see that crack appearance just above the crest, but we don't see any signs of that crack majorly in this tooth. If I can show you this again, at this point we don't see anything, but at this point we can clearly see in the sagittal view that there does not seem to be any signs of crack appearance even at 150 micrometers extending down into the root. We don't see any J-shaped radiolucency. We do see radiolucencies underneath both the roots, but they are very minor, not any major periapical pathologies. Moving, this is where the appearance of that crack is. It could just be an anatomical anomaly. Looking at the tooth from a coronal view, this is the coronal view. This is the appearance of the cavitation or the slight caries underneath the restoration in contact with the pulp chamber. As we move towards the mesial roots, in the mesial roots, we can see this is where the axial crack was visible. Here we can show in the with the yellow line. We don't see the crack visible in the coronal view. We see two canals. This is the mesiobuccal and this is the mesiolingual. They both join to form one at the apex. So this is something that the doctor should be aware of. If we move to the distal root, we've got one single distal canal, starts at one, is slightly thicker in the mid root region, and then exits at the apex. Now, if we have to measure the working length of this tooth, the distal working length, I will measure on the other section that we have. This is the transaxial view. Here we can clearly see that the working length approximately is going to be 18 millimeters for the distal, and as we move forward towards the mesial aspect, here we can see that the working length approximately is going to be 18 millimeters as well. So if you have any further questions regarding this case, please feel free to reach to our team. Thank you very much.